As of October 29, year 2020, there are about 375,180 COVID patients, in which there are 329,111 recovered cases, 39,940 active cases, and 7,114 cases. This makes the Philippines on top 21 with the most number of COVID cases worldwide, according to Johns Hopkins University and Medicine. The graph here shows the cumulative and daily cases of COVID patients ever since they were first discovered in the Philippines. The graph tells us that the cases continue to grow exponentially, but was being controlled with the help of actions of the government, such as mass testing, implementation of basic health protocols, quarantines, and more. The same graph shows of the highest and lowest number of patients in the Philippines. The highest number of confirmed infections for a day was 6,725 in August 10, while its lowest is on June 5 with only 244 recorded infections ever since May 2020. The highest recorded cases for recoveries was 40,377 on August 16, and its lowest is on August 7 with only 15 cases. Lastly, the highest recorded death cases because of COVID-19 is 258 on September 14, and with only 2 deaths on July 21. With the information given, it is to say that Philippines is only one of the countries that was affected by the spread of COVID. It also shows how the virus is very dangerous, so we must do our best to help our community to prevent the spread of the virus.
Situation of hospitals and quarantine facilities. At national level, the Philippines remains in stage 2 localized community transmission, with some geographic areas showing high transmission intensity and indications of widespread community transmission. There is an ongoing evidence of an increasing trend in the number of cases, and higher transmission is in Region 3 and Region 4A, and a decreasing trend is NCR. The bed occupancy rate for COVID-19 allocated beds is currently at 42.5% occupancy. With variation between regions, additional beds are being allocated for COVID-19 cases, as per the direction of the government. In the past weeks, there seemed to have been a decrease in daily reported cases, deaths, and recoveries. Recently, DOH has changed the reporting of recovered cases based on the national criteria. Mild and asymptomatic cases are tagged as recovered 14 days after onset or specimen collection. Additional data validation and harmonization efforts are ongoing. The government is responding across sectors, including through enhanced community engagement, targeted isolation, and quarantine measures, expansion of contact tracing, and continuous increase in laboratory capacity.
Around 13 billion pesos has been allocated to the proposed budget of the Department of Health in the Philippines for the government's response efforts and health system resilience programs for the next year. The distribution of the Department of Health's budget for COVID-19 related programs is shown in the pie chart on the screen. The Bayanihan to Heal as One Act, also known as the Bayanihan Act and officially designated as Republic Act No. 11469, is a law in the Philippines that was enacted in March 2020, granting the President additional authority to combat the COVID-19 pandemic in the Philippines. The government's response to the coronavirus pandemic has entailed billions of pesos set aside to fund different measures and programs. The Department of Budget and Management, or DBM, reported that as of August 10, 2020, around 376.57 billion has been allotted for COVID-19 related expenses, of which 360.1 billion has been released. These were sourced from 2019 and 2020 national budgets. Where have these funds gone exactly? Here are the agencies that received the funds.